Hi friends, welcome to the Factogram. In today's video, I shall tell you about some very important unknown symptoms and precautions that needs to be taken care to be dragged out of the COVID. It's been more than 17 months since the coronavirus caused an outbreak of the respiratory disease and pneumonia in Wuhan, China. Since then, this has spread around the world, infecting more than 161 million people. By now, we all probably know more about the viruses that we doesn't know before. But we are still learning more every day. The doctors know about the COVID and the diseases that it causes. COVID-19 includes the strange array of symptoms. We already know a few symptoms and their impact on our body. But let's still recap and discuss to go through all of such strange symptoms and precautions that needs to be taken care to get out of the virus. Anosmia is also a symptom. The most commonly reported symptoms of COVID-19 include fever, cough, and shortness of breath. However, as the disease has spread around the world, healthcare providers have noticed a few unusual symptoms, including the loss of smell and decreased sense of taste. In South Korea, 30% of people who tested positive for the virus said that loss of smell was their first major symptom. In Germany, more than 2 out of 3 confirmed cases include loss of smell and taste. Doctors recommend that anyone who experiences a sudden loss of smell or taste, please do self-isolate and contact their nearest healthcare provider. SARS-CoV-2 binds tightly to human cells. In 2003, SARS, or also called Severe Acute Respiratory Syndrome, spread from Asia throughout the world, infecting more than 8,000 people and killing more than 700 over a 6-month period of time. The virus that caused SARS is similar to the one that causes COVID-19. Both are types of coronaviruses. But researchers have recently discovered an important difference that may explain why the new coronavirus is very hard to stop. SARS, the virus that causes COVID-19, binds 10 to 20 times more tightly to the human cells. Corona can make babies seriously ill. Compared to the adults, children appear much less likely to get sick if they contract the novel coronavirus. However, the very young, who are less than 1 year, appear to be more vulnerable to serious illness than older children. From the records of 2,143 Chinese children, nearly 11% of sick infants were seriously or critically ill, compared to the 7% of children ages 1 to 5 years, 4% of children who are aged between 6 to 15, and 3% of teenagers who are aged 16 and older. In the United States, from February 12th to April 2nd, less than 2% of cases were in children younger than 18 years. Of these pediatric cases, 15% were children under 12 months. A multi-system inflammatory syndrome, which is also called MIS, is affecting some children positive for current or recent SARS infection. MIS is a very rare but very serious. MIS is characterized by gastrointestinal symptoms and cardiac for other inflammation. The syndrome is similar to Kawasaki disease, which is an illness that caused due to enlarged coronary arteries or even coronary artery aneurysms. Contact your doctor right away if your child has fever, abdominal pain, vomiting, diarrhea, neck pain, rash, bloodshot eyes, and is much more tired than usual. And of course, not all children will experience all the MIS symptoms. COVID-19 virus can live on surfaces for days. COVID-19 is spread primarily through respiratory droplets. When an infected person sneezes or coughs, the virus can travel from one person to another, either directly, which is why CDC recommends maintaining at least a 6-foot distance from the other people, or via an intermediate surface. The surface can also spread through the air, but this is more likely in crowded indoor areas with poor ventilation than in areas with plenty of outdoor air and fewer people. Researchers have found that the virus can live up to 24 hours on the cardboard and 2 to 3 days on plastic and stainless steel. The CDC reports that the virus was detected on surfaces of the diamond Princess cruise ship up to 17 days after passengers disembarked. However, only pieces of virus were detectable, but not viruses capable of infecting a person. People who don't have symptoms can spread the virus. One third of 565 Japanese citizens who were evacuated from Wuhan in February that tested positive for coronavirus infection never developed COVID 19 symptoms. And a study out of China reports more than half of infected children had no symptoms at all or only mild symptoms. The CDC estimates up to 40% of infected individuals do not experience symptoms. That's good news for the affected individuals but bad news for the public health because people who are infected but don't have symptoms can unintentionally spread the virus to others. Public health officials are asking all the people to dramatically limit the social contact to prevent the spread of the disease. Wearing a cloth facial covering when you go to a public or indoor place protects others because you could be infected and not know about it. Wearing a mask reduces the risk of unknowingly spreading the virus to others in the space around you. People with blood group A may be more susceptible to the infection. A Chinese study of 2,173 individuals who were hospitalized with COVID 19 found that the proportion of sick people with type A blood was significantly greater than researchers would expect based on the percentage of people with blood group A in the general population. The study also found that there were fewer sick people with type blood O that would be expected. Genomic studies of patients from Italy and Spain have supported these findings, showing a higher risk of developing COVID 19 respiratory failure in patients with the blood group A. You may already have been infected. Some people, about 20% of the infected individuals, never develop symptoms, and some people who had what they thought was a bad cold or flu may have actually had COVID 19. Scientists developed tests that can detect SARS antibodies in the blood, which is the evidence of past infection with the virus. Such tests may help us eventually understand the true extent of the pandemic. Contact your nearest doctor or public health department about antibody testing if you think you had the infection. The CDC recommends virus testing or the active infection for anyone who may have been exposed to a confirmed case of COVID 19, even if there are no symptoms. Some people with COVID 19 have digestive symptoms. Cough, fever, and shortness of breath are the most common symptoms of coronavirus infection, but many people also experience digestive symptoms, including the lack of appetite, diarrhea, vomiting, and abdominal pain. According to a study published in the American Journal of Gastroenterology, 48.5% of 204 people admitted to the hospital with COVID 19 had the digestive symptoms. A small percentage only had digestive symptoms. These individuals did not have a cough, fever, or shortness of breath. Reinfection may be possible. If a person gets COVID 19, are they immune to future infection from SARS? And how long will the immunity last? 10 to 30% of our common colds are caused by 4 different coronaviruses, and we all know that having a cold doesn't keep you from catching another cold. Across several countries, doctors have confirmed less than 100 cases of SARS reinfection. The risk of reinfection with SARS-CoV-2 varies from one person to person and also depends on the specific strain or variant of SARS the person is exposed to. In general, natural immunity and protection from reinfection is thought to last 6 to 12 months, but some people were reinfected earlier. FDA has approved the first targeted COVID 19 treatment. A COVID specific drug, bamlanivimab, has emergency use authorization. It is for people with mild to moderate COVID 19 at high risk for developing the severe disease. In clinical trials, the drug, a monoclonal antibody that targets a SARS spike protein, reduces emergency room visits and hospitalizations. The US FDA, which is Food and Drug Administration, also authorized the antibody cocktail former President Trump received when he developed COVID 19 in October 2020. Remdesivir is an antiviral medicine approved by FDA to treat COVID-19, but it is reserved for the hospitalized patients. It has been shown to improve symptoms and shorten recovery time in some cases. More treatments are in the clinical trials for this. Vaccination is 100% effective in preventing severe COVID-19. There are also 3 new vaccines that provide immunity to COVID-19. All 3 vaccines are 100% effective in preventing severe COVID-19. The first 2 vaccines, which is Pfizer BioNTech, and the other one is Moderna, which is also called mRNA vaccines. These are 90% effective in preventing infection and symptoms. And there is also a third vaccine which is called Johnson and Johnson's vector vaccine, which is also called J&J, which is 76% effective, but still well above the 50% threshold of the effectiveness. The J&J vaccine trial was underway at a time when more powerful virus strains were circulating in the community, which could have made the vaccine less effective. The J&J vaccine is still 100% protective against a severe disease caused by one of the most concerning variants, that is B.1.351 from the South Africa. Thanks for watching this video, guys. To get more interesting facts like these, please do subscribe our channel and click on the bell icon to get more notifications on my videos.